the ILLUMENATE study is these are combined two randomized controlled trials. The first one is the European RCT, and then the second one is the ILLUMENATE pivotal study, which has been conducted in the United States. And these two studies combine around 600 patients, and these 600 patients have now been analyzed for 5-year mortality, because everybody is still talking about the paclitaxel toxicity and the mortality rate, which has been issued in this Katsanos meta-analysis, especially in the long term. So this nearly 600 patients have been evaluated for their 5-year mortality rates. With regard to the patient cohorts, the trials are a little bit different, especially in the United States. In the ILLUMENATE pivotal study, the patient showed higher complexities with regard to their lesions, with regard to their baseline characteristics. So more females, more patients with diabetes. And despite this more complex patients and the combination of both, there is no difference with regard to mortality in both trials. So in both trials, the mortality rate is low, around 20% after 5 years. The mortality curves overlap throughout 5 years. And also one important thing is that there was really good patient retention and a really low loss to follow up. So it's a high quality follow up for 5 years with really no patient loss, only I guess 10% in both trials, or around 10% or a little bit less than 10% have been lost to follow up. So it's really high quality data. The data showed that there was overlap of mortality curves throughout 5 years. And at the end of the day, at 5 years, and there was no difference with regard to complex or non-complex patients. So no difference between Europe, the European RCT and the ILLUMENATE pivotal study in the United States, and the high retention to follow up. So around 8 to 9% of loss to follow up at 5 years, and and the mortality rate of around, or a little bit less, or around 20% in both trials. The conclusion, in my opinion, is that in addition, or when we look at this data, we can be reinforced that there is no mortality sign with regard to the use of paclitaxel-coated devices. And it's not only this data, we also have, in the meantime, have the SweetBed study and SweetBed data and study analysis, which also show the same signal, that there is no increase of mortality in the long term if you use paclitaxel-coated devices. And also in the Voyager trial, where a mixture of drug-coated devices with regard to paclitaxel have been used. So for me, this is reinforcing the use of paclitaxel-coated devices, as there is no safety issue, and we have a high efficacy. We can achieve a high efficacy with these drug-coated devices, and this high efficacy is very important for our PAT patients, so that they do not come back for a reintervention. The next step is that the FDA must address this and should make a clear statement with regard to the usage of paclitaxel-coated devices. This is, in my opinion, the next step which is needed. And what I also say, and I think this is something we have to do in the future with regard to any trial we are performing, that we need to show long-term follow-up data, just to see with what we are able to achieve with this kind of devices, either from an efficacy standpoint or from or what might be the disadvantage in the long term from a safety standpoint. So I think FDA needs to make a final decision. Societies should also make a decision and create a statement with regard to the usage of paclitaxel-coated devices. And I guess it's really necessary that in the future, all device trials have a long-term follow-up.